Hello everyone. Good morning from Kenya and happy afternoon, evening or night depending from where you're logging on or depending on your geographical location. Much gratitude to the Economic and Social Council, that is ECOSOC Youth Forum organizing team and fellow organizations at the side event. My name is Didan Maganya, working with an organization commonly known as FHOK as the Youth Programs Manager. Now, Family Health Options Kenya holds an ECOSOC special consultative status and is a national non-governmental organization which has operated in Kenya since the 1960s. The organization's common mandate is to increase access and utilization of comprehensive and integrated sexual reproductive health and rights services, that is SRHR services, and education for the underserved, marginalized, and social excluded population. And we are a youth-centric organization, and we have the interest of young people at heart, and of course, in our programs. We were humbled and delighted to conduct a side event at the Economic and Social Council, Youth Forum, which have just ended. Now, the side events, as well as the forum, provided a platform for young people to engage in dialogue with member states and other actors on concrete actions to rebuild from COVID-19 and to advance towards the implementation of Sustainable Development Goals Decade of Action. The Youth Forum aimed at addressing the theme of ECOSOC and the 2022 UN High Political Forum on Sustainable Development on building back better from COVID-19 while advancing the full implementation of the 2030 agenda. So this year's event was about building back better from COVID-19, how COVID-19 affected young people, and how best can we build back and recover what is lost or accelerate towards achieving the Vision 2030 agenda. Now, FHOK had two objectives. Our first objective was to provide a platform for young people within Kenya to hold an inter-county and country youth engagement on concrete actions to rebuild from COVID-19 in a way that advances the Sustainable Development Goals, focusing on SDG 4 and SDG 5, that is on education and gender equality, respectively. And we were trying to do this at the grassroots, national, regional, and global level. Our second objective was to share experience and best practice on online delivery in comprehensive sexuality education via social media, especially WhatsApp, the WhatsApp platform, where a lot of young people are in, as a mitigation factor to ensure continued health education even in the face of COVID-19 as a resilience to future shocks. Now, we wanted to share with the world our experience in doing online engagements and continuing the sexual reproductive health right education and awareness creation through the WhatsApp platform. So we decided to do a hybrid event. Um, just to take care of the populace or the population that may not have access of internet or are experiencing other technological challenges, including having gadgets or networks or electricity issues or any other thing that probably they might hinder them from accessing the full virtual event. So our side event was conducted in 9 counties within Kenya, which included Kisumu, Siaya, Kakamega, Homa Bay, Mombasa, Eldoret, Malindi, Nakuru, and of course, Nairobi. So for the virtual events, this was more interesting. We had more than 250 young people who were reached. We had representations of young people from different countries, such as, of course, Kenya and Nigeria, Togo. We had the young people from Burkina Faso, Malawi, Burundi, Nepal, Cote d'Ivoire, Bangladesh, Rwanda, Sierra Leone, Uganda, Britain, England, and Egypt. And we are grateful for these young people for making attempts to be engaged and to contribute to what is happening globally. So We were privileged to be joined by young people from different organizations within and outside Kenya. To mention just a few, to mention just but a few, Family Planning Association Bangladesh, Kushtia, Association Togolese por la Vientre Familial, that is ATBEF Togo, Circle of Jurists for the Popularization of Law, found in Burkina Faso, Association Burundaise pour la Vientre Familial, ABUBEF, found in Burundi, Enhancing Community Action for Peace and Better Health Initiative, ECAF, Family Planning Association of Nepal, Kaski, Mescripts Voices Kenya, Youth for Human Rights International Chapter Leader Sierra Leone, Reproductive Health Uganda, our neighbors joined, young people from Uganda, Fire, Yach, Kaylin, Activate Action, LVCT Health Kenya, World Vision, Naya Kenya, Center for Studies of Adolescents, United Nations High Commissioner for Refugees, Al Jawara in Egypt, among many more. And of course, we are very, very grateful to our partners and fellow young people from different organizations for creating time to join such a powerful event and an enlightening event. So this video basically will give quick briefs of what happened during the event with quick pictures and presentations of what was built by the participants during the roundtable events and which was happening in various places. So let's look at some of the discussions gathered across. Thank you.
Hello, my name is Evanine Mugore Maora. I'm a youth resource person at Family Health Option, especially the Kakamega Youth Center. We held a discussion. ECOSOC has this bill this year on youth taking action for a sustainable future. Family Health Options Kenya has been honored to be part of these discussions, and we have had this discussion with the youths, and we discussed on the SGD 4 and the SGD 5. A brief introduction to what we do in Kakamega Youth Center. So Kakamega Youth Center is committed to provide quality, comprehensive and integrated SRHR services, information to all people with special focus, young people, marginalized and the undeserved. So I'll go to whatever we discussed. In order to deal with this issue, we had a focus group discussion with the youths here at the center. First, we had the discussion with all the youths, and then later on we were subdivided into two groups, whereby group 1 dealt with SDG 4 and the other group dealt with SGD 5. So I'll have to present what we came up with. So first of all, I'll start with SGD 5. So SGD 5 dealt with gender equality. So on gender equality, we said that women and girls everywhere must have equal rights and opportunities and be able to be free of violence and discrimination. Women's equality and empowerment is one of the 17 SGDs, but also integral to all dimensions of inclusive and sustainable development. And on this SGD, we say that this SGD plays a great role in all the 17 SGDs. So we came with the challenges. So our main question was, how did COVID-19 affect the SGD 5? How did COVID affect gender equality? So first of all, we came with these challenges that high cases of rape. People were at home when COVID-19 came by. So people are at home, or their relatives are at home. This is when the uncle sees the girl and says, oh, by the way, my niece looks good. And there were rape cases. And the fact that people are concentrating on COVID-19, the people don't care about what is happening. People are like, this COVID is here. This is our major focus. So there were high cases of rape and incest, and people didn't just care. Early early marriages is our second point, whereby young girls came up with a way of solving the problems at home. Most of our parents were laid off, and in order to see, you saw the burden, like our parents are not employed, we need to eat, we need to wear, we need basic needs. So our girl said to, if I can do away with myself, if I can just withdraw myself from this family and get married, I will have helped my parents in one way or the other. So our girls ended up being married. Our third point was child labor. Child labor, whereby our young boys and the young girls went into manual work. This is whereby our parents don't have money. There are no businesses. Businesses are not running. Nothing is happening. So in order to help our family, I have to go. Me as a child, from 14, people are just working. I have to go to Mjengo. I have to do such work in order to help our family. Our fourth point was domestic violence. When COVID came, there were lockdowns, and most people had to stay at home, especially the men. They couldn't go to clubs, they didn't go to meet, our social places were closed. So men and women had to stay at home. And there was depression, mental illness. This brought domestic violence. The only way our men could talk about it was, the only way women could do it is fight with each other. And there were high rates of domestic violence. There was also increase in HIV infection. This came by way because, as our first point, we have said that there was incest, there was sexual harassment, and HIV. One of the causes is sexual intercourse, and this was brought about by the high rates of sexual intercourse because people are idle. Yeah, people are very idle. Another point that it really affected people was youth-friendly services were not accessible. Places were locked. People are dealing with COVID-19. So our major focus is COVID-19. So why are you going to come and tell me you need me to provide you with a contraceptive or the family planning method when you have a child? People are like, you should be concentrating on COVID-19. So youth-friendly services were closed, not only because people are not providing these things, but because there was restrictions. There were lockdowns. People are not supposed to move just anyhow. Our last challenge that we came about was harmful society norms. Here I'll read on female genital mutilation, FGMs. This happened because people are at home. People are like, you're going to be motivated, and these kid brought an opportunity whereby we can do this and no one will see, because people are not focusing on other things, they're focusing on COVID. So COVID-19 really challenged that SGD5. What were the actions taken? We also discussed the actions taken. The actions taken, first of all, we saw our government really come through for us, because the government, through the parliament, the legislature, enhanced the law about sexual harassment, whereby, you used to hear people say, she's under 18, you'll just get jailed. Don't try that. And I was so happy to see people say that, because they knew I can't go and harass a child. I can't go and do this to a child. Our children were really protected that time. Another way the government came through was through the program, the Kazi Mtaani. The Kazi Mtaani was whereby the youths were employed, the single moms, anyone was employed. Mostly it was the youths. This really did away with transactional sex, and people had money. There was flow of income. Young people had money. It really helped the youths. Another way was the youth organizations. The organizations that came up, especially FHK, that's when we really embraced the social media transformation, the use of social media to pass SRHR information. In fact, our WhatsApp were very busy because youths that time were idle, there was no schooling, so people are just there, they need this information. We really did something great, and people got to know a lot about SRHR. Another way is young people really embraced the use of social media to learn, and we got a lot of advocates from that. There were many advocates who started advocating about rights, and gender equality. So those were the actions taken, and I'm glad that they were taken. What are our recommendations? So these are the recommendations that we came up with. One of our recommendations is ensure women's full and effective participation and equal opportunities for leadership at all levels of decision making in political, economic, and public life. This is to ensure that women get to participate. And when COVID-19 comes, our single mothers are not that affected because they were not laid off, or they are empowered enough to know what they can do when another pandemic comes. Our second recommendation was ensure universal access to sexual and reproductive health and reproductive rights. Yes, let us ensure that SRHR is universal and it can be accessed any day, any time, despite the times that are happening. Is it a pandemic? Is it not a pandemic? Let's ensure that universal SRHR is accessible. Another one is enhanced use of enabling technology. In particular, information and communication technology to promote empowerment of women. Let technology really help. That was the only thing that was not affected by the pandemic. So empowering people to know about technology is a really good thing. The fourth one is strengthen policies and enforceable registration for the promotion of gender equality. Let us make gender equality a song. Let us make gender equality a thing that people know. I have equal rights as a woman. A man also has equal rights. Okay. The other one is eliminate all forms of harmful cultural practices. All the practices that affect the genders, affect the female, affect the male, especially our women and girls. Let us make sure that they are not victims of what our society used to believe in the past. My last point is building more SGBV rescue centers. Yes, let's come up with shelter houses for our girls, for our women, a place whereby they can see the rescue, they can feel safe. And those are what we came up with on SGD5. So my next point is on SGD4. SGD4 is on quality education. So on quality education, we say that ensure inclusive and equitable quality education and promote lifelong learning opportunities for everyone. So let's make sure that education is there for everyone, that people can learn despite their cases, who they are. Let us ensure that people get education, and not only education but quality education. So our first question is, what are the challenges that affected education during the COVID-19 pandemic? So first of all, schools were closed because COVID-19 came and schools were closed. So this brought a disruption to education across Kenya. Like, people went home, people had to go home. There was no schooling because you don't know who is sick. The second challenge was inadequate access to information. People are not informed at that time, in terms of books, in terms of skills, in terms of SRHR education, because everyone is closing and you don't know who is sick. COVID-19 is not something you just say, I'm having COVID-19. Not all learners have been consistently embracing the homeschooling due to lack of proper materials such as internet and digital gadgets. Okay, let's be honest, not everyone is financially blessed. Not everyone has the money to buy a mobile phone, computers. Not everyone has access to internet. So most people in the mashinani, they didn't have to learn. They didn't have the ability to learn. So it was really bad, and they were really affected. Another one is lack of physical learning has led to increased number of dropouts from studies, from schools. When COVID-19 came, people went home, and as a new norm, people started new skills, hard skills, people had to go for jobs. So when school was reopened, students had to choose, am I going to do what has to give me money, or am I going to go to school? Most of the people, or most of the children, chose money because at the end of it, money is going to make you a living. That was their choice. Another one is an increased number of teenage pregnancy leading to school dropouts. People are very idle, as I said, and people are not going to school. So, from rape cases, from vices in the community, girls got pregnant. Teenage pregnancies was really high. The statistics said so. So, and this led to school dropout and they really affected education. Another major point is misinformation on SRHR from some of the online platforms. Technology was vast at that time, so people used to spread every type of information that they had, and you didn't know what is right, what is wrong, because people were just saying it. So what action was taken by Kenyans mostly in terms of education? Use of social media. We saw social media, social media. People are using social media, TV. People are being taught. There also were mobile apps that were helping people learn, CRE, English, mathematics. People really embraced that form of education. So what are our recommendations concerning this SGD form? So our recommendations are, let's strengthen let's come up with a policy that ensures that people go back to school. No matter, people got pregnant, teen pregnancies was high. So the government should come up with a policy whereby the teenage girls who got pregnant are accommodated back to school. Another recommendation is organization to strengthen the use of social media platforms to pass the right SRHR information. I'll say that if people knew where can I get this information, where can I get the right information, there wouldn't be misinformation. Like people would not have communicated the wrong information because I know this is where I can get the right information. So this is only for the organization that deal with SRHR information. The third one is government must ensure that students who have fallen behind receive the support that they need to catch up to expected learning targets. When COVID came, people really fell back in terms of education and people have not been able to catch up. I'll say it's the responsibility of the government to make sure that every student catches up with wherever they are supposed to be and they get to learn something. Quality education. My last point is ensure resilient recovery. Most of the schools in the mashinani don't have financing, and when you lack financing, you can't accommodate all the students who are in the area. Many people in the mashinani go to public schools. It's upon the government to finance the schools to ensure that our schools, our students get quality education, not just any education, but quality education. So I'll wind up by saying we need to build capacity to provide blended models of education in the future. We need to enhance, we need to build our schools, whether we have a pandemic or not, because in future we need to have a system whereby we can survive a pandemic. Thank you for listening to my presentation, and I'll say that let's be part of that nation that builds on the SGD. Not only the 4 and the 5, but all the 17 SDGs. Thank you.
Indeed, that is an excellent presentation from Kakamega. Thank you very much, Evelyn Mwaura, for that presentation. Now let us see what happened in Nairobi.
Kindly introduce yourself. I'm Anne Debwa, a youth advocate from Family Health Options Kenya. Family Health Options Kenya is the leading SRHR service provider and information in Kenya. On 18th of April 2022, we had the privilege of holding the Economic and Social Council Youth Forum side event in Nairobi.
What about the current crisis worries you the most as far as accessing information on sexuality is concerned? What gives you the most hope?
From the panelist discussion, we had a focus group discussion, and these are the responses. Fear of contracting COVID-19. All funds and resources were redirected to mitigate COVID-19. There is government policies, accessing SRHR information and services, There's myths and misconceptions, and there's the spiking up of literacy levels. Some of the hope that young people had is that government will be involved. There's digital platforms where you can access SRHR information. Some also base their hope on religion, and also there's availability of PPEs to protect one from contracting the virus.
Okay, our second question is, as a comprehensive sexuality education CAC facilitator or champion, what can be done to reach out to the youth, especially the marginalized young women and girls and those in low-income areas who don't have access to technology during and after pandemic?
The responses include community dialogues involving grassroots leaders and the community gatekeepers. Youths can also be engaged meaningfully. You can also have partnerships with CSOs, CBOs, school, mosques and churches. You can also do door-to-door activities and peer mentorship.
Okay, our third question, what is the comprehensive sexuality education impact on gender equality, as well as long-term impact to the online consumers?
CSC can be used as a tool for behavior change. There's the gender biasness is being demystified by use of CSC. More women and young people are being involved in decision-making processes, and more women and young people can now advocate for their rights.
What alternative means do we have as young people in accessing information and youth-friendly health services in the event such pandemic occurs?
We can use institutions to disseminate SRHR information. The institutions include schools, churches. We can also come up with hotline or helpline numbers. We can also improvise self-service tools like the HIV self-test kit. We can also do online sessions.
Okay, question 5. What are some of the challenges faced in creating awareness or accessing services during such pandemic? How can they be mitigated?
Government restrictions, including the abolition of mass gatherings. There is also commodity stockouts, that is FP commodity stockouts. Funds have also been redirected to counter COVID-19. There is inadequate finances and there is high GBV cases. Most of the mitigations measures include partnerships with stakeholders and the government.
What is the role of young people in ensuring social accountability by institutions and the government, especially in the mitigation of such pandemic? What advocacy strategies can be used to address gender gaps?
Young people can do advocacy campaigns. Advocacy strategies include policy monitoring and public accountability. There is policy dialogues and review. We can also do campaigns for policy change. We can also build the advocacy capacity of stakeholder groups.
Our last question is, what is the role of young people, especially in industrial field, in helping the current or future pandemic? Are they donating money, producing product for health workers, providing free or affordable prevention products such as masks?
They are making financial donations. Some have come up with income generating activities, thus creating more job opportunities for other young people. Some also make products like masks. Thank you.
Excellent. Indeed, those are some of the deliberations that were done by Nairobi during the roundtable discussions. Now, moving swiftly, let us pick on one of the best practices that we saw during the COVID-19 manifestation, and let us look on how young people were able to access education, comprehensive sexuality education during this tough period.
Hi everyone. Considering time zone globally, I hereby salute you all. I go by the name Margaret Chao, and I'm hereby privileged to present to you the CSC best practices. Welcome. So this is the Fhok overview where the youths are engaging in a mass media, and the previous personnel issued out with a glance of our vision, the mission, and when Fhok was initiated. And we created a WhatsApp group, and welcome to our WhatsApp journey where the youth were so delighted for the creation. And to start off with the introduction, the implementation of CSC through digital form platforms began in 2016. This is initiated by Fhok and IPPF in order to reach young people out of school. A total of 19 young people were trained as online CSC facilitators, and currently we have 102 trained online CSC facilitators. The initial pilot was implemented in 3 counties, that is Nairobi, Nakuru, and Mombasa. This has since expanded to all the 10 sites where Fhok Youth Program is present. The platform used in WhatsApp since it's affordable, accessible, and easy to operate. Our current coverage via WhatsApp, we have active facilitators of a number of 150, active WhatsApp groups are 90, and estimated number of people reached since 2016 to 2021 is 15,200 plus. So the key role for this process, we have different persons taking their role. We have the facilitator, we have the health provider, the peer provider, the participant, the youth center coordinator, the monitoring and evaluation, and the CSC team lead. So we can start with the facilitator and its role. So the facilitator moderates sessions to ensure session goals are met. They also prepare and submit reports. The health provider, invited from time to time to give expert opinion on a subject matter. We have the peer provider, where the young people who are part of the group to ensure effective referrals are made when needed. They prepare and submit reports. We have the participant, the young people with an age bracket of 10 to 24 years engaging in the sessions. We have the youth center coordinator, who helps in mobilization of participants, coordination, and organizing the setup of the groups for smooth implementation. The person also prepares and submits compiled reports per site. The monitoring and evaluation, who analyzes the pre and post and online surveys. They also help track implementation. And the CSC team lead, overall coordination of the CSC program. Components covered. We have the SRHR and HIV/AIDS, the gender, the violence, relationship, the youth-friendly services, drugs and mental health, life skills, peer education, and advocacy. Challenges of using WhatsApp for the CSE. We have information leaking through screenshots, lack of cooperation from participants during sessions, i.e. sharing irrelevant material. We have internet or bundles. We also have commitment from participants, i.e. competing interest. Setting the ground. 1. We identify the CSC facilitators with the age bracket of 18 to 24 years. Then we sensitize teachers, parents, religious leaders, etc. in order to create bias help in mobilization. We also ensure that your organization should identify the curriculum to ensure a group size of 10 to 30 participants per group is maintained for effective management. Participants should equally understand that their safety in the online platform is safeguarded. building capacity for the CSC online. They build their capacity to strengthen quality and delivery of the CSC both online and offline. We also focus on the CSC curricula, facilitation skills, pedagogy, group dynamics, and control. They train peer providers on effective online referrals. So as you can see, we have the examples of the materials in the slide and reasons as to why you may not get period. Referral linkage to SRHR services from CSE. The peer providers are part of the WhatsApp groups to ensure that any young person who would like to access a service is linked up with the service provider at identified clinics. The participants at the beginning of the session are given mobile numbers of the peer provider, the youth center coordinator, and the service provider. They are informed that they can reach out to any of the numbers before or after the sessions through calls or side chats via SMS or WhatsApp. During the youth-friendly sessions, the participants visit the youth centers and clinics for familiarization. A referral code is given both to the young person and the service provider of the center for easier access of the young person to the center. And tracking and monitoring and evaluation. Tools have been developed to ensure quality implementation and tracking of the online sessions. The tools include the CSC checklist that guides the whole implementation, the CSC session plan that guides the session to ensure that they are happening as scheduled and objectives are met, online pretest administered a week before start of each component, the online post-test administered after each component. To get tool, you can mail us at info@fhok.org. So in brief, we created a WhatsApp group per county, and each group has a monitoring and evaluation officer, a youth center coordinator, CSC team lead, and the project manager youth for quick turnaround. They feedback meetings at the specific youth sites every Friday, monthly youth program Zoom calls with youth resource persons, head office, support team, youth center coordinators, and the 10 CSC youth representatives that give weekly feedback to PMY or the CSC lead, and the monitoring and evaluation, the monthly visits to the youth centers. Thank you.
Hello guys, my name is James Carter, a student at Cooperative University of Kenya, and today I'll be taking you through what the young people discussed in Malindi. So in Malindi, these are some of the things that the young people discussed through the roundtable discussions. I'll share with you the first slide. We have the ECOSOC Youth Forum, that is Vision Youth 2030, and the logo of Family Health Option Kenya. Our main focus was on SDG 5, that is achieve gender equality and empower all women and girls. So FHOK, I'll explain to you. FHOK Malindi Youth Center is one of the other youth centers under Family Health Option Kenya, aiming at creating awareness to girls on sexual reproductive health and planning and family planning, to create a platform on activism where the youth can express freely in matters concerning sexual reproductive health and rights, and be champions using 3 main strategies, that is training, peer-to-peer sessions, in-school outreaches, and community outreaches. So some of the challenges faced during the pandemic by the youths, these are some of the things that they came up with. Increase in a number of teenage pregnancy, forced marriages, STB5 cases increases, child labor, poor access of information and services at the youth center, increase in gangs, So, reasons that led the youth not to access information during pandemic. One of the reasons was poor environmental condition, e.g. lack of electricity and other basics a youth can access. Then the other point was lack of skilled healthcare provider. What can be done to reach out to more youth? That is sensitization through social media, e.g. forming a WhatsApp group on CSC. Another way was alternative ways where youth can access information, creating awareness through posters, local radio stations, through Steve Barazas, use of social media, e.g. WhatsApp, Facebook, page Twitter, sensitization through written articles. Role of the young people in ensuring social accountability by promoting good governance among local leaders, by involving youth during public participation, by representing their issues affecting the community to the members of the county assembly through memo writing, young people to participate in budget making process. Some of the challenges faced in creating awareness during the pandemic and how to mitigate them. The first challenge was time. Not all young people were available during the agreed time, and this can be mitigated by creating norms before the beginning of the session. Another challenge was lack of internet bundle support to participants. To mitigate this, participants can be supported with internet bundles. Government policy on restriction of public gathering by conducting session one-on-one. That was the end of my presentation. Thank you.
Hello everyone, my name is Irene Walker, a peer volunteer at Mombasa Youth Center, Mombasa County. I'm going to take you through the deliberations we had as a center. So here are the deliberations we did in regards to COVID-19 pandemic, youth taking actions, Fhok, Mombasa Youth Center. Introduction. Mombasa is the second largest city in Kenya and was one of the first in the country to be affected and later locked down because of COVID-19 pandemic. First case of COVID-19 was confirmed on 22nd March 2020. About 1 in 5, that is 18% of people in Mombasa County are adolescents aged between 10 to 19 years. About 1 in 5, that is 17% girls aged between 15 to 19 years have begun childbearing. During the pandemic, teenage pregnancies increased by 20%. GBV and mental health cases, i.e. depression and anxiety, etc., equally increased. The priority within government facilities shifted to COVID-19, hence affecting access to SRH services and information. The actions taken by the Youth Center. 1. Use technology, that is WhatsApp, to conduct CSC sessions. Online HSC has been an innovative platform that provides young people with the knowledge and skills to make informed decisions regarding their sexuality and lifestyle. We trained peer educators in Mombasa. 15 WhatsApp groups comprising of between 20 to 25 group members each were formed and sessions conducted in a structured way. The facilitators, who equally doubled up as peer providers, equally linked young people, that is online participants, with access to SRH. 2. Condom Mtaani Initiative. This was formed to mitigate access to SRH information and services. Trained peer educators conducted one-on-one condom distribution and demonstration within the community while adhering to the COVID-19 protocol set by the government of Kenya. Young people who lacked access to technology were effectively reached through the initiative. 3. Community education and awareness on COVID-19 pandemic. Community engagement is critical to slowing the spread of COVID-19. The Youth Center, through MOH, provided clear and consistent messages that are informed by current and up-to-date information on COVID-19 through digital platforms such as WhatsApp status. Young people were supported to lead safe offline and online awareness, raising interventions including the dissemination of reliable and context-specific information about COVID-19 myths among their peers and community networks. 4. Integration of mental health program. This is very crucial. With increased in mental health cases during the pandemic, especially among young people, those who lost hope, had depression, had anxiety, such cases, Mombasa Youth Center was able to integrate mental health in partnership with IMHA that provided a safe space for youth counseling and support. Our conclusion or recommendations: for effective delivery of SRH information and CSE, meaningful youth participation at all levels should be enhanced, and I insist, should be enhanced. Digital platforms is a space that should be explored and utilized more for youth empowerment and support. We all know that the digital world is the new world. What could be better than embrace it as it comes? Thank you.
Good afternoon. My name is Maureen Mundo, the Youth Center Coordinator Bondo. I'll be presenting on the matters we discussed during our FGD around SDG 4 and SDG 5.
And from our FGD discussions, these are the deliberations we came up with. Young people mentioned that issues around the current crisis, what they face or they feel that is a matter of worry, include unemployment, health status, the new HIV infections, unwanted pregnancies, and high economic standards. What gives the young people hope when it comes to issues like unwanted pregnancies? The government has come up with provisions of offering contraceptives at public facilities which are not being charged. About HIV infections, the government has come up with new preventive measures. On unemployment, young people have ventured into creativity and innovations and are not dependent on employment. About high economic standards, the young people mentioned that these can be solved by having in place a stable government. Reaching out to the young people during the period of a pandemic, because we had lockdowns, the young people mentioned that they could make use of public gatherings such as churches and chief barazas, and also the use of community health volunteers at the community level, since the CHVs tend to move from house to house. On the impact in the community from what we deliver based on the comprehensive sexuality education, the impact is majorly seen on educated individuals, and this has proved that the level of education really matters when it comes to relaying information. The people who are a bit enlightened tend to receive the information positively and bring a change in the community. Then after sharing information, we also have that increase in the uptake of SRHR services and information. This is seen both in the youth-friendly facilities and at the public facilities. Young people who have been empowered conduct step-down trainings among their peers, and this is a great impact because information continues to be transmitted from one person to another.
Alternative means of accessing information during a crisis or a pandemic. We mentioned that we could use social media. For instance, Facebook has a free mode that enables young people to access information in case they lack internet or bundles, which is very much convenient to the young people. The youth also tend to interact with their peers who volunteer at the youth-friendly centers to gather more information. We also had the use of both electronic and print media such as posters and flyers, which can be distributed to other young people. Challenges faced in creating online awareness is that in some home states there is no electricity and some do not have electronic gadgets, so they are not able to access information. Resources such as internet and data bundles are not affordable to all individuals, or let me say most. The slowdown of internet due to many users accessing information also delays the process of seeking information from the online sites, and also the availability of distorted information from different websites. This was mentioned as a challenge because most people tend to post information just to get views or likes. The roles of young people in ensuring social accountability. The youth mentioned that they can mobilize individuals to seek services from within the community. The youth can take part in social media campaigns. The youth can stick to guidelines from the government and serve as a good example to the others from the community. Inquiring from departmental heads and get adequate information. Youth can also act as information channels and also engage in blogging. Among the advocacy strategies that we can use during a pandemic, we mentioned online campaigns, use of print media and social media, door-to-door mobilization, and reaching out to people at the grassroots levels. The role of young people in industrial field is to ensure the right content is used. For instance, people were not sure about the COVID vaccine. They had so much doubt, and hence the relaying of information that proper information is seen to be very necessary so that people are sure of what is there. Use of creativity and innovation, for instance, in the issues of contact tracing that we witnessed during the COVID period. Relaying of the right information is the role of young people, since they are the major population. The youth can also volunteer, for instance, in the distribution of face masks and illustrating how to wash hands properly during the period of COVID. And youth can also help in taking part in research to get more information. Some youths were involved during the period of COVID in the sector of innovation. For instance, we witnessed cases whereby some young people were engaged in the development of oxygen ventilators and in local production of face masks. Those were our deliberations, and according to our discussions, young people feel that when they are involved in whatever takes place, they can take charge and bring a change in the community so that we do not face that too much negative impact as it happened during the COVID-19 period. Thank you.
Hello everyone, I'm Joyce Achieng, a student at Cooperative University of Kenya and also a young person at Family Health Options Kenya. I'll be taking you through the Family Health Option Kenya ECOSOC side event at Homa Bay Youth Friendly Center. I hope you learn a lot from the presentation. Welcome. Now jumping to the presentations. So we are going to discuss more about ECOSOC. ECOSOC means the Economic and Social Council. This is an annual initiative. It evolves into a key platform where young people contribute to policy discussions at the United Nations through their collective ideas and solutions. The Youth Forum was organized for the first time in 2012. The main focus is the role of the youth in monitoring and evaluation, review and implementation of the agenda, and the achievement of the Sustainable Development Goals. In that context, the Youth Forum offers a unique opportunity where they can air where they can air their voice, where the youths can air their voices, their voices and their opinions, share their ideas and think together about what should be done to achieve the Vision 2030 agenda. But it also addresses the challenges they face as youths and their contributions. And it shares experiences and best practice on online delivery in CAC via social media, that is WhatsApp, as a mitigation, and it even ensures the continuous health education even in this phase of COVID-19 and as a resilience to future shock. The goal for this ability is to enable the youth, volunteers, and partners to share the best practice in CAC and self delivery in COVID-19 pandemic with the international communities. The objectives include providing a platform for the youths in Kenya to hold an inter-county and country youth engagement and create action to building from COVID-19 in a way that advances the Sustainable Development Goals, the SDG 4 and 5, at the grassroots, national, regional, and global level that can make to achieve the youth-specific SDG targets. So the theme for this event is COVID-19 recovery, youth taking action to, to a sustainable future. The youth taking action for a sustainable future. More about FHOK is that, as you all know, that it is an NGO organization which operated since 1960. The organization core mandate is to increase access to increase access and utilization of the comprehensive and integrated sexual reproductive health and rights services for the underserved, mitigated, and socialized excluded population. The challenges faced by the youth during the COVID-19 pandemic is limited access to SRHR services. Some youth stopped their businesses. The youth-friendly services were closed, and also the service providers were reduced in the centers, and some of them stopped working. So the questions include: what alternative means do we have as young people in accessing information and youth-friendly services in the event such a pandemic occurs? So the first thing we can do is doing outreaches with few people, sensitizing the community through purchasing booklets that are related to SRHR services. Constructing more youth-friendly centers to curb the problem of overcrowding, creating posters, designing posters, billboards, and flyers,
stick to medication.
creating
And I think that
websites
as
for
we
online
say,
learning
on matters of
and studies.
education, I think that we are tackling education as well.
The
We
second
need to
question
organize
is, what are some of the
schools.
challenges faced in
I would
creating
like to give
awareness
like a
or
few
accessing
examples. For
services
example, if a young person is
during and
reaching out
after
to us,
the
this young person
pandemic?
was informed correctly. And
The
then as we
challenges
said,
include
we to be able to
neglect,
inform children
lack
going
of
back,
trust,
to the same
fear,
place
youth
there are a lot
fear,
of challenges. And
stigma,
then for this young person
remote areas,
started not to talk.
inadequate, well-trained
Unfortunately,
personnel,
so
and
today it's not
also
just
inadequate funds from the
the
donors
data that
or
we see.
advocates. Yeah.
There are
So the
like
solutions that we came
for
across,
cases,
that we discussed,
if
include
a female pregnant
reducing
with women,
ignorance,
parents losing their jobs. So
reducing ignorance of services
this
providers.
work
The
that
second
we
one
do as
is
civil
creating
society
awareness
to
on
support
SRHR
some
and
of the
GBV,
issues that are within the country
sensitizing the
and
community to
like
avoid
we started
fear
with
among the youth,
support
educating more peers so as to solve the problem of inadequate information, building more youth-friendly centers in the remote areas. The third question is, what is the comprehensive sexual education impact on gender equality as well as the long-term impact on online consumers? So the first one is It reduces gender discrimination in the society. It reduces stigmatization, fairness in the provision of services and services delivery. It creates awareness. It prevents cyberbullying. It empowers the mitigated women and girls. And also, it promotes gender equality through the information and knowledge. Now, as a CSC facilitator champion, what could be done to reach out the youth, especially those in the low income areas who do not have access to technology during and after the pandemic? Things that could be done include establishing equipped digital centers in the areas around the youth so that they can access, providing basic education on how to access the internet. Some of them don't know how to operate them. Carrying out outreaches in the community to allow young people to access the CAC, carrying out referral services to the youth-friendly facilities, and lastly, providing the IEC materials that contain SRHR information. That brings me to the end of my presentation. I hope you learned a lot from it. Thank you.
Indeed, those are some of the enlightening things that happened during the side event. Thank you very much, James, Joyce, and Chow, for those excellent presentations. Now, let us have a look at some of the cuts that happened in Eldoret as we wind up.
Let's say YouTube. You can access information about the STDs, condoms, or on such. And finally, even the youth centers. For example, here, access to information has been made easier. Like, I am at ease talking about my sexuality with my peers than I am with maybe my parents, someone older. For example, if I'm coming to the youth center to access information on sexuality, we find that maybe one of my community members finds me here. They are going to misjudge me because they might think that I'm starting to practice immorality. But I might find hope in the youth center because the youth are given a safe space, and we have also rights protecting the youth. So I will be more comfortable coming to the youth center than talking about my sexuality in our community where people misjudge me.
Me as a young person, especially as a lady, it's hard to access information about sexuality because we are so much questioned. Like when you go to a facility or a pharmacy for this, maybe you have engaged in sex, you want to ask for this because, especially for us ladies. Also we can say and the pregnancy test kits. Yeah.
Also can say as a lady, if I have a single parent, so my father, I can't go to him for him to explain to me everything about life. So it's difficult.
It's hard for especially women to initiate a conversation about sexuality.
Yeah, mostly can say women are living in this society because men are the most people in the society. So a woman has no say.
And if you have a say, you need to be more empowered now. You'll be misjudged, your behavior will be questioned. Because why are you asking? Even if you want to seek information about that family planning,
you can go to a youth center because here we can find both ladies and men. So we are able to communicate and understand each other. Yeah, interact together. So it's easier.
And then these social media platforms like YouTube, there is Google.
For example, the marginalized communities. We have this SMS app that you register yourself and then you can ask questions through SMS, which is free. You are able to get information out of it. So that is accessible to anyone.
Social health workers, so that they could move from house to house.
Young ladies and women can be engaged through community theaters.
Imesaidia mayouth wengi at least tumeweza kumanage HIV and AIDS. Watu wanajua about this, about how mtu anaweza contract hizo STI.
When, let's say, a young lady or someone knows about themselves, they are able to distinguish about the developments in their bodies.
The youth are able to make informed choices and decisions concerning their sexuality. We have the sexual rights that the youth get informed about, so they are able to learn about them and they are able to practice them. Their rights to privacy, confidentiality, rights to safety.
99% of us youth do have access to these online platforms like Twitter, Facebook, WhatsApp, all those platforms. So it's easy for us to get that information and know what is right and what is wrong, the positive and the negative. It is all, we can all get it.
We can use the mass media as to pass information.
A challenge that we had was social distancing, where we were not able to meet and share information.
I can say my challenge was accessing the mask was such expensive.
So another challenge that we had was the mobility with the curfews and movement. It was not easy to meet, thus sharing information was hard. Most of the people shifted to social media, where they put their content there so that people can access it there. But to find, for example, the rural areas, it was hard because they had no access to internet. Funding the youth organization will mean that the youth are able to get more information, they're able to get more access to services also.
The government should also invest in capacity building of the youths, like training, seminars.
Well, that marks the end of the brief of whatever happened during the side event at Family Health Options Kenya. Much gratitude to the ECOSOC team who organized this event. Very, very much grateful to the young people who attended and the young people who are still following up into these deliberations. Much gratitude to our partners and the government for allowing such an event to happen. Until next time, thank you so much.